Today, we are talking about impacting policies within our own health system, using as a case study efforts to ban the sale of sugar-sweetened beverages in healthcare settings. The average American consumes nearly 3 times the recommended amount of added sugar every day, or almost 20 teaspoons of added sugar daily. More than a third of that is from sodas, sports drinks, and energy drinks. Drinking just 1 soda per day can increase the risk of dying from heart disease by nearly a third and raise the risk of diabetes by 26%. Yet restaurants and cafeterias in health settings commonly offer these drinks for sale. In 2015, UCSF became one of the first health systems to ban the sale of such beverages due to the tireless efforts of a core group of people applying emerging scientific evidence to the policies of our own institution. The resulting success of UCSF's Healthy Beverage Initiative allowed for the dissemination of the policy to other settings, including Sutter, but the road was not easy. So we are privileged to have joining us today 4 panelists who are all change makers themselves. Laura Schmidt is a professor of health policy in the School of Medicine at the University of California, San Francisco. Jamie Schmidt is the Director of Clinical Research at Sutter Health's California Pacific Medical Center's Research Institute. We have Claire Chenarel, who's the Senior Associate Vice Chancellor for Campus Life Services at UCSF. And finally, we have Bauer Taken, a restaurateur who started his career in Turkey with a passion for food. SF Kebab Mediterranean Grill opened its doors in 2017 at the UCSF Mission Bay campus.
I was up on our Parnassus campus listening to a really passionate speaker talk about target marketing of low-income minority populations by soda companies. And I was kind of riled up by the talk. And as I walked out, I stood across right in front of Moffitt Hospital, stood across and looked at the street and looked at our food court. And in that food court was a lot of junk food type, places with a lot of patients and families who were basically stuck there because their family members were in the hospital and they were drinking these really big sodas. And I thought, gosh, I work for a health sciences university. We shouldn't be selling this stuff. So I literally stood there on the street and I pulled out my cell phone and I texted our vice chancellor for research, who at the time was someone mentoring me. And I said, I wrote him and I just said, I feel like a hypocrite. And very soon after that, I found myself with a mysterious invitation in my inbox to join the Chancellor's Wellness Committee. And when I got there were folks from Campus Life Services there who asked me to talk about what I knew about sugar-sweetened beverages and how to deal with them from a health policy perspective. And that was sort of the beginning of the end of sodas at UCSF. The how really has to do with partnering with amazing people in Campus Life Services. And we're really passionate, like they totally could understand this idea and brought just a lot of, we can do this to the table. In our case, our chancellor, we sort of worked from the top down and the bottom up at the same time. Our chancellor and our CEO of our medical center and our chief medical officer, they all sort of got the message and were pretty supportive. The chancellor essentially said this has to happen voluntarily. Our vendors need to actually agree to do this if we're going to make it work. And that meant a lot of effort, boots on the ground to, and mainly the Campus Life Services folks who just literally went vendor to vendor and talked to people like Bauer and just kind of said, we're all in this together, and we're a place that's about health. And this is, what we feel is the right thing to be doing. There's a lot of evidence that this stuff is bad for health. And that was really the way it happened. And it was one person at a time being brought in partnership on this?
It started with relationships. Laura and our colleague, Dr. Alyssa Eppel, they reached out to our CEO at CPMC, who formerly worked at UC as a clinician and a researcher and a leader. And they shot him an email and said, hey, we'd like to work with you to institute an HBI over at CPMC, California Pacific Medical Center. And Dr. Browner, who is a huge advocate of a healthy beverage initiative, reached out to me. He connected me with Laura, and together we wrote a grant, we were funded, and we implemented healthy beverage initiatives at a couple campuses here.
As I was listening to everybody talk about kind of this change, it reminded me of that change management model. Like the first time you hear about something, you get kind of nervous and your initial reaction is maybe not so positive. But then once you go through all the stages, you look back and go, wow, that was actually really great.
When you talk about how Laura and Claire were saying how passionately they felt about it for the employees and our patients and our visitors, these are the values that a healthcare system wants to provide to all of these people. And so I was just like, yeah, I'm joining Laura, like where I'm in. So it was easy.
Evidence played the biggest role, but I want to make clear it's how it was conveyed. So the way that Laura and her colleagues conveyed this message was very clear and convincing and simple. So I think we get a lot of opinions about food, and it does get a little confusing, especially if you're not a scientist. I'm not a scientist. But the way Laura explained it to me, she said, when somebody looks at a cookie and chooses to eat it, they know they should only have one. But when she explained that when somebody drinks one of those 32 ounces of Coke, thinking they're getting replenished with water and nutrients and they're drinking basically poison, just the light went off that people don't understand what they're drinking. And so I just want to make sure that a lot of the great ideas are out there, but it's just how you can convey them and convince others to get on board. And I think the word ban it does sound negative, right? When you're in a communications role, we are really lucky in Campus Life Services to have a team who does nothing but work on communications. And so they immediately said, you can't use that word. So healthy beverage initiative sounded much more positive. But we were really concerned about the impact this would have on revenue to our vendors. And also we wanted to encourage vendors to come to our campus. We don't want a lot of barriers. And so it does involve educating every new vendor on the importance of this. And, most get on board, but I think this is just one of the decisions that we had to make.
The first year was difficult, of course, but yes, as we tried to have an alternative healthy drinks. Absolutely. And then we have, other alternatives, and we always look for whatever the healthy drinks we can add without sugar added to it. So our customers kind of used to it. I don't get anybody would come and ask for Coke or any sugary drinks.
But what came up right away was, are we going to lose money by taking sugar sweetened beverages off the shelves?
The critical thing there was that every vendor had to agree to do this voluntarily, because it wouldn't be fair if Bauer and his restaurant adopted the policy and then some other vendor on campus didn't, because then people might go to the other vendor and it would just be economically not unfair. And so there were, in some cases, vendors who were really struggling with the concept. And so in some cases, I was called upon as the nerd that I am to bring my PowerPoint slide presentation in and literally sit across the table with a vendor and walk them through. This is why it's so important for us to do this, this way. This is why it's different if sugar is being ingested in food. Then, answer all the questions. Why not artificial sweeteners and so forth? So there was a lot of that. Our faculty really came out and did what in politics you would call ground softening, which is giving talks, giving presentations, showing up at Campus Life Services events, and explaining why this is so important.
When Laura and I would go and pitch this to CEOs at Valley Region hospitals, it's really not that hard to bring the PowerPoint, as Laura described, and tell them what the challenges are with, obesity, diabetes, and the constellation of syndrome, like metabolic syndrome. That's an easy sell. But when you get to the point in which you're saying, now we want a healthy beverage initiative, all of a sudden there's this thought about employee satisfaction when we take something away instead of saying, we're bringing something in, we're going to provide better choices for you because we care about you. The latest research that Laura and team have done with cost effectiveness and showing there's a savings in your healthcare plan, by pitching that story to our leadership who's in charge of our benefits and healthcare plan, that now becomes more of a corporate decision. And you can have a two-pronged approach, really, to talk about the devastating impact of obesity and everything that goes along with it. We get that. And now we can actually save money to our healthcare plan, because at our healthcare organization, cost effectiveness and fiscal responsibility is really becoming increasingly important.
As an owner of a restaurateur, you're going to look for, of course, economic impact of this. If I'm going to make money or not lose money. How I would look at this as an economic impact of it, I will try to have healthy clientele who would come for a long run than having a, unhealthy society that it's going to be maybe not, maybe it's going to be for short run.
Stay close to home. If you have a novel idea that hasn't been tried, you probably got a better chance of convincing your own institution to try it than convincing somebody else's institution. Currently, we're actually scaling the Healthy Beverage Initiative across the UC system. Often you're in a nested environment where if you can make it work in your local environment, you can scale it and make it happen in at the higher levels of your own organization. And but it really is, the first step is showing that it works. And that's something that researchers are trained to do. We're trained to do research. And so we can be really empowered in if we can get out of a mindset that the only thing we can do is publish in journals and generate extramural grants, and start thinking about the things we can do on the ground in where we live to make a difference.
And I'm so glad that campus did this, and I'm part of it. And it fits into our philosophy of having healthy Mediterranean food, as it blends in really beautifully.
And now when you walk around campus, I think people are super proud that we did this. It was a little nerve-wracking in the beginning. There was some hesitation, some number crunching. But now, it's pretty funny when we walk around campus, like with a guest, and we tell them we don't sell Coke or Pepsi, that's sugar sweetened, and they just can't believe it. And we're really proud of it. You created an environment where, grabbing water is just as easy as it was to grab a Coke. Just how simple a change like that can have really big impact.
Most people don't think of policies as institutional policies. You think of governmental policies. And so it really is a gestalt change to start thinking about my own institution as a place where policy change can happen. And once you get over that hump, which is a really important one, then you realize how empowered you are. Hey, I work here. I'm a stakeholder here. If I'm passionate about something, I can make that happen.